Here is a comprehensive lecture note on bronchiectasis and cystic fibrosis. Bronchiectasis. Definition ***. Bronchiectasis is a chronic respiratory disease characterized by the irreversible dilation of the bronchi and bronchioles, leading to impaired clearance of mucus and bacteria. Causes ***. 1. Infections. Bacterial, viral, or fungal infections can cause inflammation and damage to the airways. 2. Genetic disorders. Cystic fibrosis, primary ciliary dyskinesia, and other genetic disorders can increase the risk of bronchiectasis. 3. Autoimmune disorders. Conditions like rheumatoid arthritis and Sjögren syndrome can increase the risk of bronchiectasis. 4. Allergic reactions. Allergic reactions to substances like dust, pollen, or chemicals can trigger inflammation and damage to the airways. Symptoms ***. 1. Chronic cough. A persistent cough that produces large amounts of mucus. 2. Sputum production. The production of thick, sticky mucus that is difficult to expel. 3. Shortness of breath. Difficulty breathing or feeling winded even when at rest. 4. Chest pain. Pain or discomfort in the chest that worsens with deep breathing or coughing. Diagnosis ***. 1. High-resolution computed tomography, HRCT, a CT scan that provides detailed images of the lungs and airways. 2. Chest X-ray, a radiograph that provides images of the lungs and airways. 3. Pulmonary function tests, PFTs, tests that measure lung function, such as spirometry and plethysmography. 4. Sputum analysis, analysis of the mucus produced by the lungs to identify bacteria, viruses, or fungi. Treatment ***. 1. Antibiotics, medications that target bacterial infections. 2. Bronchodilators, medications that help open up the airways. 3. Mucolytics, medications that help break down mucus. 4. Pulmonary rehabilitation, a program that includes exercise, education, and support to help manage symptoms and improve lung function. Cystic fibrosis. Definition ***. Cystic fibrosis, CF, is a genetic disorder that affects the respiratory, digestive, and reproductive systems, causing severe damage and leading to premature death. Causes ***. 1. Genetic mutation. A mutation in the CFTR gene that codes for a protein that regulates the transport of salt and water in and out of cells. 2. Autosomal recessive inheritance. A person must inherit 2 copies of the mutated gene, one from each parent, to develop CF. Symptoms ***. 1. Respiratory symptoms. Cough, wheezing, shortness of breath, and frequent lung infections. 2. Digestive symptoms. Malabsorption of nutrients, diarrhea, abdominal pain, and poor growth. 3. Reproductive symptoms. Infertility in males and reduced fertility in females. Diagnosis ***. 1. Sweat test. A test that measures the amount of salt in sweat. 2. Genetic testing. Testing for the CFTR gene mutation. 3. Newborn screening. Screening for CF in newborns using a blood test. Treatment ***. 1. Medications. Antibiotics, bronchodilators, and mucolytics to manage respiratory symptoms. 2. Enzyme replacement therapy. Medications that replace digestive enzymes to manage digestive symptoms. 3. Lung transplantation. Surgery to replace damaged lungs with healthy ones. 4. Gene therapy. Experimental treatment that aims to repair or replace the faulty CFTR gene. I hope this comprehensive lecture note helps you understand cystic fibrosis.